Thinking about the youth population, there's some reports that have suggested that it's possible that this may be the first generation that doesn't necessarily outlive their parents, and that's a very concerning and sort of provoking thought. If we don't reduce risk for future cardiovascular disease, for future diabetes in our pediatric population, our young adult population, as these individuals grow and mature, as they enter into adulthood, as they enter into the workforce, and they have chronic disease that comes along with them, then that will reduce their productivity. We won't have as healthy members of society. They'll be at risk for developing complications that go along with those diseases. My take on why we should really try to work hard to resolve these issues from an ethical standpoint is that bottom line is it's the right thing to do. And I think that a lot of the results that we're seeing now in terms of disparities, if we're honest with ourselves, really is deeply entrenched in the sort of the social, political history of our country. And so I think that we owe it to our creed as a nation, we owe it to our values and our morals that we hold to be true in our country to really make a concerted effort to ensuring that members of our society have equal access to quality health care. So I applied and was awarded one of the pilot grants to look at obesity outcomes in adolescents. And there in Jacksonville, in our city, we have a dense urban core where there's a large percentage of African Americans. It's a complex issue, but we know that there are certainly factors that contribute to obesity rates among adolescents, like there's poor dietary exercise behaviors just across the board. But we've learned that there's a lot of targeting of these age groups by different companies that are really trying to promote their unhealthy products that are nutritionally poor, that are calorie dense to these specific communities. We are identifying high rates of obesity both in the adolescents and also in parent and adult caregivers of the same household, which we refer to as PACs. We've also found that the adolescents and the adults tend to resonate a little bit more with some of the more positive aspects as opposed to the negative aspects of behavior change. So the things that influence their dietary and their exercise behavior tend to stem more from a positive look on those motivators as opposed to really focusing on the barriers. And that was kind of an interesting finding. We think that that may be important as we move forward and thinking about interventions with this group in terms of how we frame the message. I'm learning more about using CBPR, community-based participatory research approaches. We have a community research advisory board at the Mayo in Jacksonville that we sponsor. And so I think that there are some exciting opportunities for us to really improve our ability on the Jacksonville campus to engage with our community in research and really try and impact upon the health and the health outcomes of our community. Mayo Clinic addressing disparities very much falls in line with our mission and who we are as an organization, as the needs of the patient come first, serving as a model for the rest of the nation. And how to provide equitable care to patients from all demographic backgrounds is one of the greatest things that the Mayo model of care can contribute to disparities research.